you, Mr. Chairman. Thank you and Senator Tester for this hearing. Secretary Wilkie, you performed some of your best work while wearing a boot. I've joined you. I hope to do as well. You have, let me start with this. The grant-making working group that is proposed, how do you envision? Do you envision that there will be community organization stakeholders to be among members of that working group?
Absolutely, yes, sir.
That I think it makes sense to me, and I may have some suggestions if you're willing to entertain those. And then your proposal that the department is working on to connect community organizations and state and local governments. You mentioned Senator Bozeman's efforts. Senator Tester and I are leading an effort in regard to suicide prevention called the Commander John Scott Hannon Veterans Mental Health Care Improvement Act. Here's my question or request. Is there any reason your proposal could not be incorporated into the legislation that we're talking about, that a number of the members in this committee have introduced, and mark up in that fashion and move to the Senate floor? We're waiting, here's a bit of a complaint, we're waiting on VA technical assistance on our bill, and we've been waiting a couple of months. As you do that VA technical assistance, perhaps you can incorporate your suggestions and improvements into the bill. And I would encourage you, if you're interested in this, to visit with Senator Tester and to me and to other members of the committee to see if we can have a result that maybe is more
yes, sir.
pursued.
I will come visit you. I will be all very candid. We are just starting down this road to develop a national strategy and then operationalize those efforts. I do think that having a list of things that we must do without having that national roadmap may create a problem for us in terms of our capacity to carry out those programs. We are very deep into alternative therapies on the opioid front and the pain management front. I don't know that we have the abilities to carry out many of the programs that are in the legislation. I will go back and take another look, but when I sit down and talk with you, that will be the premise that I start with, that if we're going to make these programs work, we have to be able to carry them out. And right now, as the head of this task force, what I see as the most readily available means at our disposal to address veteran suicide will be that grant portion where we can engage the local communities.
That's useful and understandable. A significant portion of Senator Tester and my bill is related to community organizations and their involvement in suicide prevention. And it is, you and I have had conversations, this committee has worked on community care. It's how do we get things closer to where people live and more readily available. So there's no question. I think that we're aligned, and I would welcome that conversation. Mr. Chairman, I know the vote's been called. I will not have a chance, I suppose, to, I want to hear the next panel's testimony, but in my absence, I would like to highlight that we have a Kansan, Ms. Kavanaugh, who is a panelist on that, and she has impressed me and my staff greatly, and I'm pleased that she's here today to testify, and I encourage my colleagues on this committee to pay specific attention to her and her story and her mission. And her daughters are with her as well, and we're delighted to have them here. Mr. Chairman, I thank you for the opportunity to testify before I go vote.